All right, welcome to the show. I got something that may or may not make me crash out. And, honestly, when you see, I'm pretty sure it's in the title of the video, uh, it's from Newsweek, and it's even better. It's an opinion piece posted by a Dr. Kevin Sabet. Now, the doctor thing is funny because, but yeah, we'll get into that in a second. I'm going to try not to ramble too much in this video, but when I say you need to stick around, you really need to stick around because we are going to cover so much more than just this article. We're going to get into this guy's background. We're going to get into I always talk about alcohol, alcohol, and just how bad it is and just how accepted that is. Well, we're just going to look straight at the statistics. So I'm not just making assumptions anymore. We can just look at it. We're going to look at some statistics on Delta 8 and just those two things. My God, it is going to blow your mind. And what may even blow your mind even more is the statistics that they cite in this article to be like, yeah, this farm bill loophole was bad and a public health risk. Just a bunch of bullshit, man. All right. Without further ado, before we get into this opinion piece itself, I do want to go over Mr. Dr. Kevin Sabet's background. And, we'll keep it brief. So he's a doctor, and at least he calls himself one. I mean, I guess he technically is one, but education. Because when I see a doctor come out and write an article like we're about to read, you be like, is this guy a doctor? Did he get his fucking doctorate from degrees.com or something anyways, Sabet is a graduate of the University of California, Berkeley and Oxford University, where he received his doctorate in social policy as a Marshall Scholar. Critics have noted that despite his affiliation with Yale Medical School, Sabet does not hold a medical degree or medical training. His academic background is in social policy and political science, which some legalization advocates argue undermines his credibility when making health-related claims about cannabis. And boy, does he, as we'll get a little bit of a taste, of that soon. So yeah, he has an affiliation with Yale Medical School, a graduate of fucking University of California. He's and he goes around calling himself a doctor. I mean, if you have a doctorate, no matter what kind of doctorate I have, I'd probably call myself a doctor too. Fuck it. But this guy ain't no actual medical doctor. So he's just a fucking poli-sci fucking douchebag. Okay. All right. Now, he is the founder of a little known organization called Smart Approaches to Marijuana. When I seen that, I was like, okay, so is this guy is he kind of lift the legal marijuana lobby, where he's we need to get rid of this hemp loophole because it's undermining actual legal weed? Is he in that camp? No. When you actually look at Smart Approaches to Marijuana, Smart Approaches to Marijuana, SAM Inc., is an American political organization opposed to marijuana legalization and commercialization. What do you mean Smart Approaches to Marijuana? What a kind of a fraud of a name. It almost it makes it sound like you're for marijuana to some degree, maybe not a lot. No, this is just straight up opposed to it. Yeah, so this guy's a dipshit. I need you to get that in your mind. So that's his background. Now let's get into this article. We're going to pivot around and check on he cites where he gets his numbers from and just what he's referencing. We're going to go over it all, and I'll try not to lose my mind too much. So from Newsweek, the great Newsweek, one of the most unbiased, truthful outlets I have ever read. That was sarcasm. /S. The hemp ban shows America still works. With a federal ban on intoxicating hemp products officially signed into law, November saw the most consequential change in U.S. drug policy in decades. And people truly interested in fighting for public health should recognize this for the great victory it is. Okay. Intoxicating hemp, which contains addictive chemicals linked by the FDA to everything from heart issues to nausea. I'd like to know what these, he doesn't provide a link to what the, I guess, actual addictive chemicals are, like THC itself, whether it's Delta 8, Delta 9, Delta 10, 9-0, fucking whatever. It's not addictive. And what else do you want me to tell you? So it is linked to by the FDA from everything from heart issues to nausea. We're going to circle back to that in a moment. Was only ever legal for sale in the U.S. because of a legislative error in the 2018 Farm Bill. That mistake created a gray zone, which a brand new addiction for profit industry promptly swooped. Oh my God. Jesus Christ, this guy's a joke. Their chief products were edibles and drinks packed with hemp-derived THC, chiefly the psychoactive Delta 8 THC, which is nearly identical to the component of marijuana that produces a high Delta 9 THC. I mean, yeah, it is very similar. In fact, Delta 8 it's a little bit less potent than Delta 9, and that's why I kind of like it so sometimes. Like, hitting a Delta 8 pen compared to like a Delta 9 pen, like Delta 9 pen, it's just gonna like kind of, make me lazy, kind of knock me out. But like Delta 8, like depending on the strain, like, man, like it's kind of like vaping like Adderall. Okay. I mean, that's kind of like THCV too. Jesus Christ. I'm very well versed in these illicit, dangerous drug products, if you can't tell. So now what he cited here, the links to nausea, this is, I think he might reference this a couple of times. So this is from fda.gov, and we're going to look at, this is 5 things to know about Delta 8 THC. Number 1, Delta 8 THC products have not been evaluated or approved by the FDA for safe use and may be marketed in ways that put the public health at risk. Okay. Number 2, the FDA has received adverse event reports involving Delta 8 THC containing products. Get this. The FDA received 104 reports of adverse events in patients who consumed Delta 8 THC products between December 1st, 2020 and February 28th, 2022. Of the 104 adverse event reports, 77% involved adults, 8% involved pediatric patients less than 18 years of age, and 15% did not report age. 55% required intervention, evaluation by emergency medical services. So your number of 104, what a laughable number. What a laughable number to like come out and make this bold claim that this is a public health risk. Oh my God. Okay. So half of that, like, so 50-ish, 55, 60, give or take a couple, required actual medical intervention or hospital admission. 66% described adverse events after ingestion of Delta 8 THC containing food products, brownies, gummies. Adverse events included, but were not limited to, hallucinations, vomiting, tremor, anxiety, dizziness, confusion, and loss of consciousness. What does this sound like to you? Does this sound like some dangerous, illicit, like toxic drug? Or does this just sound like someone had a little bit too much Delta 8 THC and fucking panicked and went to the hospital, which happens so much. And they normally just like, get you some fluids and shit. But like, oh my God. And like in the article, he's like, it has been linked to adverse health effects, like, heart issues, blah, blah, blah. And it's like, you link to this. It's like, what? National Poison Control Centers received 2,362 exposure cases of Delta 8 THC products between January 1st, 2021 and February 28th, 2022. And we're not going to go over that. You can pause and read. Has psychoactive and intoxicating effects. No shit. Delta 8 THC products often involve use of potentially harmful chemicals to create the concentrations of Delta 8 THC claimed in the marketplace. Now, I don't think they give a ton of information on this, but like here is something I am absolutely for. Require public lab testing, like third-party lab testing. Require that. And if you want to ban certain like cutting agents or whatever, like vitamin E or shit, like by all means. But to just say, oh, we need to eliminate it all is crazy, especially when there's been like 2,300 reports of the poison control, whatever, and like 100 medical events. What are you talking about? Can we be real for one fucking second here? Like, wait till we look at the numbers of alcohol. Your mind is going to be blown. Delta 8 THC products should be kept out of reach of children and pets. No shit. Manufacturers are packaging and labeling these products in ways that may appeal to children. I hate this shit, man. Like, you have vapes or stuff like this, and you know, if you want to like make the package look cool or something, it's like, that's for kids. It's like, I'm sorry, but can adults not just enjoy like advertisement packaging? Like, I guess enjoy, but like, you know, colorful packaging. Like, sometimes it's just cool. Maybe I'll fucking buy some because of packaging. Yeah, sometimes I'm a fucking brain dead normie. Sue me. But like, okay, another thing that you can absolutely regulate: make sure these products are clearly labeled and age gated. That's fine. All right, problem solved. Anything beyond that, that's on enforcement, and that's like on the parents. I'm tired of this, like, oh, we need to ban fruit vapes because it appeals to children. It's like, so what, dude? Let me enjoy my fucking fruit vape. Like, goddamn, so annoying. So yeah, like, this is bullshit, and this was even published under the Biden administration in 2022. So yeah, okay. Now back to the article. Within 2 years, hemp-derived THC had already become a public health scourge. Just take a look at the grim numbers. Between 2021 and 2025 alone, more than 10,000 people called poison control about Delta 8 across America, from Ohio to Kentucky to California. Edibles and other intoxicating hemp products drove up emergency room visits, poisonings, and other dangerous THC exposures. Worst of all, as an October study from Ohio Medical Research shows, kids were bearing the brunt of the rise in THC exposures. Pediatric incidents around THC jumped more than fivefold between 2018 and 2024, a rise driven in the vast majority by edibles. Okay. What they fail to mention here is when they say like these scares them are like fivefold. It's like, yeah, it went from like 2 to like fucking 20 or some shit. 2 to 10. Like, what are we talking about here? And this whole, like, this is what they cited regarding the 10,000 THC related exposure cases. This fucking article, like, it kind of makes their fears even seem stupider. There's just a very quick look at this. The trend for these Delta THC exposures and poisonings or whatever, which is just absurd, it's trending downwards. What is happening? The thing you cited hurts your own stupid argument. Like, what the hell? Anyways, the move to reverse this legislative error began almost as soon as it became law, and that fight was one my organization, Smart Approaches to Marijuana, was honored to play a central role in. Oh my God, you're such a fucking dipshit. Jesus Christ. But thanks to the intoxicating hemp industry's big money PR pushes, amplified by a media that often uncritically repeated dangerous, unfounded claims that edibles were really nothing to worry about, because they aren't. You know what happens when you drink too much alcohol? You die. You know what happens when you take too many fucking THC edibles, no matter what synthesized or natural form it is? You could get, you're going to have a bad time. You're going to feel really bad, but you're not poisoned. You're not going to die. Oh my God. Okay. Until mid-November, when, as a part of a deal to reopen the government, a hemp ban passed. Yes, friends of the industry tried once more to stop it. Senator Rand Paul, most notable among them, notwithstanding the damage hemp has done to the Kentuckians he's supposed to be helping, but they failed decisively. What changed? What do you mean? The scourge has done to Kentuckians? Are you stupid? Please tell me this guy is just a grifting liar and he isn't actually this dumb. The public woke up and started demanding lawmakers follow the data and the science. That's why 22 Democrats crossed the party line to back a ban when it came down to the final vote on whether to leave it in the bill. The new law gave a 12-month grace period before enforcement begins. During that time, the Food and Drug Administration will need to promulgate official regulations around hemp THC, and the law enforcement arms of the federal government will need to prepare themselves for what the reality will look like in 2027. Expect that period to be rife with efforts from industry lobbyists to push Congress on stopping or hinder the implementation of the law. Indeed, already a quick survey of news stories show the familiar false slant that the ban is not a public health triumph, but an economic setback. Nothing could be further from the truth. What do you mean? It is not only a public health setback, it is also an economic setback. Both are true. People switch to, like, they got people in like states where weed, like normal legal weed, marijuana, people from states where that isn't a thing they have access to use this loophole to be able to get essentially access to the same stuff. And it's data has shown that as a result, alcohol, everything across the board has gone down. Like, alcohol consumption and the perception of alcohol has gone down. I wonder how many people who had chronic pain, anxiety, depression, whatever, in these states where marijuana is illegal, but they were able to get it through this loophole, like how many people were helped by that versus now how many are going to be fucked and might have to go back to like opioids or just go back to drinking every day. Yeah, what a great public health win, you idiot. You now you're going to push more people to go to alcohol. You're going to push more people to go back to hard drugs. Like, oh my God, you're so stupid. Okay. There, the State House has sent a hemp ban bill to the Senate. At the moment, the details are still getting hammered out, but as written, the bill would adhere to federal standards on this dangerous drug. Dangerous drug that is in itself a very good thing, and it's made even better by the fact that pro-hemp voices in the House as much as said the federal ban was hurting their efforts on the issue. Federal policy matters, fighting normalization matters. In other words, when science trumps partisan politics and public health policy, everyone wins. Dr. Kevin Sabet is the president and CEO of Smart Approaches to Marijuana. Yeah, you're also a stupid dipshit who, like, I hope you're just like lying and you know you're lying versus like actually believing this. Because if you actually believe this, you are probably one of the stupidest people on the planet. So this is from the CDC. This is just facts about U.S. deaths from excessive alcohol use. And this is just a small sample of deaths from alcohol. So, they're talking about 100 cases of medical events from Delta 8 THC. They're talking about like 10,000 poison center calls that probably just led to like drink some water and rest, brother. Like, I guarantee you. Let's look at deaths from excessive alcohol use. Excessive alcohol use is a leading preventable cause of death in the United States. About 178,000 people die from excessive drinking each year. I literally do not need to go on. Like, this is just a small section. This isn't accounting for like other bad things from alcohol. This is just from excessive drinking. This isn't like long term. This isn't like DUIs or just this social incidents and just unrest that can come from being drunk and whatever comes with that. 178,000 a year, and we're fucking trying to cherry pick like 100 people. There were 100 medical events in the year 2020 to 2021 from Delta 8. There were 10,000 poison control calls. Even though if we looked at the results of those calls, it probably just said drink some water and get some rest. Like, oh my God. 178,000 from fucking alcohol. Jesus Christ. Okay. And I tried hard to find how many people died from like Delta 8. Guess what? The like actual answer is like pretty much zero. But here's a study from nih.gov. It's just a small sample. But of the cases that resulted in death, most occurred between 2018 and 2021. 4 deaths listed a D8 Delta 8 THC product as the only suspect product. And that's just suspect. That's not even confirmed because you can't confirm it because Delta 8 THC or any THC is not going to kill you. Now, if there's some dangerous additive in the vape or the cartridge, that's a different story. But even then, it seems like in a 3-year period, we had 4 deaths. 4 versus 178,000 from excessive drinking alone a year. Oh my God, dude. Like, it's so dumb. And I'm not advocating that we should ban alcohol or anything like that. My stance is very clear. I think like drugs pretty much across the board, I'm sure you could sway me on a few, should be decriminalized and perhaps even legalized and regulated. Because what I put in my own body is none of your business. God, it's so stupid, man. Like, I don't know, like, this is brain rot. This is straight up brain rot. If you like are panicking over 100 medical events, which resulted in no deaths, or 10,000 poison control calls, which is probably a fraction of all their calls. And literally all were probably like, rest and drink some water. Like, how did people get away with this, man? Like, how? Jesus Christ. Let me know what you think in the comment section down below, and I will see you in the next one. If you made it to this point in the video, I just want to give a special thank you. If you enjoyed it, please hit that like button down below, and if you really enjoyed it, maybe consider hitting that subscribe button while you're down there. I want to hear your thoughts in the comment section. I will try to reply to any and all comments that I can. Until next time, watch that video on screen.